Ryan, afternoon. Will you be doing the introductions? Or do you want me to? You're on mute. You're on mute.
Okay. Yeah, I'll go ahead and do that. And what I'll do is I'll just I have just a couple housekeeping things to go over before we bring the candidate in. And then when the candidate's in, I'll let the candidate know that we'll be doing introductions, give her a chance to introduce herself, tell us a little bit about herself. We'll ask her 10 questions, and then if she has any questions for us afterwards, we'll go in the order that we're asking the questions. So the order that's listed here on the screen.
Yep.
Yep. And yeah. So
okay.
Yep. I'll go ahead and do that, facilitate that.
Hello, Ryan.
Afternoon, sir.
Afternoon.
Afternoon, Mayor. Melissa.
Hello, Dr. Cleary.
Hello, Mayor.
Hello.
All right, so we'll wait about 2 more minutes, and then I'll go over a couple of housekeeping things before we bring Dr. Cate on.
Thank you, Ryan.
It looks like we've got everyone from the interview committee is here.
I don't see Melissa, Amanda, or Nalia on yet.
Melissa's on. She just
Is she on? Okay, good.
isn't showing up. She's hiding.
Hello, Mayor
Hi.
Byers. I'm here. I'm present.
Good afternoon,
I'm not
everyone.
seeing everybody apparently.
I see Nyla on there.
Okay, I'm just not seeing everybody. That's weird.
I'm not either.
Your sound was very quiet, Commissioner McKinney.
I'm just getting situated. If you could give me a minute, sorry.
Okay.
Melissa, I will go ahead and sign off and sign back on just to see if that helps.
Okay.
Okay, I'll go over a couple things. First of all, I want to thank everyone for taking the time out of their schedule today to do the interviews. I know it's been hard to find time that everyone can meet. So we do have 3 candidates that we'll be interviewing. So Dr. Cate will be right now at 3 o'clock, and then we have Dr. Atterbury tomorrow at 5 o'clock, and Dr. Bard at 6 o'clock tomorrow night. The interviews are scheduled for 60 minutes apiece. Once we get started, then we'll start the time. And I'll be moderating to kind of make sure that things keep on track so we can get through all the questions. All candidates have received the interview questions. They received them about 27 hours in advance of their interviews. There are 10 questions. And out of fairness, we've asked the candidates not to attend any of the interviews that precedes their own. We're asking for interview committee can go ahead and ask clarifying questions, but we ask that not ask additional questions just out of consistency. Discussions for qualifications will take place at the regular Board of Health meeting on June 30th with the possibility of a vote for the new health officer at that meeting. What we'll do is we'll introduce ourselves in the order that it's listed on the screen right now, and those are also the order that we'll ask the questions. And the questions will be put on the screen, so everyone will be able to see what the question is. So any questions before we bring Dr. Cate on?
I have none.
Okay.
Is Amanda on?
Yes. Yes.
Okay.
Yep. So
My
we've got
sound
it.
any better?
Oh, there you are.
Is that better?
Still
Yeah.
kind of quiet. Might have to speak loudly.
Okay,
Yeah, we
okay.
yeah, we can hear you. Yeah, it is just a little bit, not real loud. So, okay, so I guess we'll go ahead and bring Dr. Cate on, and I'll go ahead and then get it started and do the introduction. And then what we'll do is we'll go around the room and everyone can introduce themselves, to state your name, your position on the board.
All right.
Okay.
Dr. Cate's joining now.
All right. All right, Dr. Cate, are you there?
Dr. Cate, you're muted and your camera's off, if you don't mind.
Oh, yeah, there we go. Here we go.
All right.
Hey
All
there.
right. Hello, Dr. Cate.
Hi, how are you?
Good, good. Thank you for joining us and taking out your time, your busy schedule for an interview. And
Okay.
also thank you for your interest in becoming a health officer for the Yakima Health District. What we'll do is we'll go around the room and introduce ourselves, the interview committee. And then afterwards, if you want to tell us a little bit about yourself, and then we do have 10 questions to ask you, and you have received those questions in advance.
Thank you.
Yep. And then afterwards, if you have any questions for us, feel free to ask those questions.
Okay.
We do have 60 minutes for the interview, so we'll go ahead and get started. So we'll start with Commissioner Anderson.
Good afternoon, Doctor. I'm Ron Anderson, County Commissioner and Chair of the Health Board.
Hello.
Hello.
Hi, Dr. Cate. I'm Dr. Sean Clary. We know each other, and
Hi, Sean.
I'm the Vice Chair of the board.
Nice to see you. It's been a
Nice
long.
to see you.
Good afternoon, Dr. Cate. Thanks for joining us. I'm Andre Fresco. I'm the Executive Director of the Yakima Health District.
Nice to meet you.
It's a pleasure. Thank you.
Dr. Cate, good afternoon. My name is LaDon Lindy. I'm one of the Yakima County Commissioners and a member of the Health Board as well.
Good
Nice to-
afternoon, Dr. Cate. I'm Patricia Byers, and I serve as the STD representative on the Board of Health.
Yeah, nice to see you again, Patricia.
Yeah, good to see you also.
Different venue, different issue.
Hi, Dr. Cate. I'm Melissa Sixbury, the Director of Disease Control for Yakima Health District.
Nice to meet you, Melissa.
You as well.
Hello, Dr. Cate. Amanda McKinney, County Commissioner. Nice to meet you.
Yeah,
And
nice.
thank you for your interest.
Yeah, I can't see your face. It would be nice to see you.
Hello, my name is Nyla Duval, and I am a council member in Toppenish, and I also am a Board of Health member as a city representative.
Nice to meet you, Nyla.
And I'm Ryan Iback. I'm the Chief Operating Officer at the Yakima Health District.
Great.
All right. You want to tell us a little bit about yourself?
Yeah, I think maybe I should tell you, give you a little more in-depth history on my public health background. So I think you see my resume, which is, I just kind of, that was several months ago I sent that over, and I'm not sure how much detail it had. So you understand that I have a master's in public health from the University of Michigan. I did, and it was in epidemiology. And it was quite a long time ago, but I did a research project for that in nutritional studies, and I looked at migrant farm workers' nutritional health in Wisconsin. After I finished my master's in public health, I spent several weeks with a biostatistician who was also a nun. Her name is Rosalie Battelle. And we traveled the Pacific Islands and did some health education on the health effects of nuclear testing in the Pacific Islands. I did that for a part of a summer. And then I came back to Seattle and worked for the Veterans Administration, looking at some health issues around nutritional status. And then after that, I was accepted into medical school. And in my third year of medical school, spent several months at the Centers for Disease Control in the environmental wing of that environmental department, and did a study looking at pilot study for looking at health effects from the Hanford nuclear site. And then that was published in a journal not a couple of years later. After I finished medical school, I also did residency at the University of Washington. And then I moved to Yakima to work with the residency program and to be a clinician with my husband, who is Russell Meyer. Let's see, I also, while I was in the residency program, I was in charge of the evidence-based medicine curriculum and kind of a research part of the curriculum for the residents. And I also did a study with Susie Ball, who's a genetic counselor over at Memorial on shared decision-making. Sort of that's kind of some of my interests in those first early years. And then I had a relationship with Chris Spitters. I think there was, at some point, I had thought about maybe becoming a public health officer for Yakima. And so I had a relationship with Chris Spitters for a couple of years and learned a lot about what you do as a medical officer. Now that was quite a while ago, but yeah. So that's sort of some information you might find interesting.
Okay, thank you for that information. So we'll go ahead and start with the questions. And so Commissioner Anderson will read the first question.
Doctor, this is a multi-part question, so if you would like me to repeat any of that, feel free to ask.
And I did get a copy of the questions too.
Okay.
And so
describe a time you developed and maintained or strengthened a relationship with a person or group inside your organization, but beyond your regular work group. Why did you develop the relationship? How did you develop it? What did you do to maintain or strengthen it?
Okay, thank you. And I really appreciate getting the questions in advance because they took a lot of thought. And well, as you probably know, is about 10 years ago, I was working with Planned Parenthood. I'd been hired to be the medical director of Planned Parenthood, basically, and I didn't quite realize the extent of it, but they were on the verge of losing their accreditation, and they had failed 2 surveys when they hired me. So I came in with this really big task and instituted a review of the entire medical system across several clinics. And that included reviewing their medical procedures, one-on-one reviews and evaluations of providers, implementing a standardized workflow and lab procedures and medical documentation systems that didn't exist. And then subsequently, they passed their accreditation twice after that. And I really attribute the success of that to the fact that I was paired with an administrative support person who was extremely detailed, and we complemented each other's strengths, and I felt like it really made a winning team, and we were able to do a really good job for passing the accreditation twice.
Thank you.
Okay, the second question will be asked by Dr. Cleary.
Okay, Dr. Cate, can you tell us about one of the best decisions you made in the last year and describe what resources, data, processes, judgment, et cetera, you used to make the decision? And how have you confirmed it was one of your best decisions?
Okay, so at this time I do teaching, but I also am primarily a clinician. So I decided I would take as an example caring for patients. And when I care for patients, I have many opportunities to make quote unquote the best decision. But I just recently, for example, I had a patient who had been having increasing shortness of breath over a couple months and ended up in the ER and had a CT scan that identified a mass. I knew it might take several weeks, especially with COVID, to get a pulmonologist in Yakima to see this patient. In Ellensburg, we don't have access, a lot of access to specialty care that we have in Yakima. And in Ellensburg, so I did know that there was a radiologist that was starting to develop interventional radiology service. And I called him promptly, and he was willing to see the patient and do a CT guided biopsy. It was like, I think, his second biopsy that he'd done in Ellensburg. I promptly followed up on the path results, which were back in less than a week, and it showed that the person had lymphoma. And I called the oncologist, basically using my resources, who was on call, and the patient was in his office in a couple of days. And then within 2 weeks from when I first got that result of that CT scan, the patient was started on chemo. And I felt like by taking the right steps, being proactive, I successfully maneuvered this patient through a medical system that has been severely hampered by the COVID epidemic, and the patient got the prompt care that they needed. And that active management has really led this patient to most likely have a curable and a very good prognosis. Which Sean probably is kind of aware of these things too. So, yeah.
Good. Thank you.
Just kind of the way I work, that shows.
Okay. Andre will be asking question number 3.
Thank you, Dr. Cate. The health officer is often obliged to be a visible face in the community and at the state level to advocate for the health district, must navigate organizational politics, and has to address a wide variety of controversial issues. Please provide an example of when you've had to deal with these types of complex issues, how you dealt with the situation, and how you prevented the situation from getting worse.
Well, I decided that the best place or the way I can explain that is I'm a trustee for YVC. It was this first time I'd ever been a trustee for a board. And I've been there now for about 7 years. Every month we have board meetings, and from time to time, employees' concerns and complaints can make for a very exciting meeting. But as a trustee, I need to know what my place and role and as a trustee is, and that what I can do is I can listen to complaints of employees at board meetings, but there are others that are in charge of handling those issues, and that I don't meddle in areas where I as a trustee don't have jurisdiction, and I follow the rules for how to bring personal concerns to the group for discussion. So for example, if there's a trustee that has some concerns, there's a process. So I guess is what I work as a respectful team member, and I follow the rules.
Okay, thank you. And question number 4 will be asked by Commissioner Lindy. Commissioner, you're on mute.
Why, yes, I am. Thank you. I was just going to say, give me a few seconds. I'm just writing down a couple of notes and I'll be ready.
All right.
Okay, very good. Dr. Cate, the Yakima Health District expects its health officer to be able and willing to articulate and promote public health practices regardless of personal values. What does this mean to you?
Well, just simply, I think as a Yakima Health District Officer, I would take my cue from the state health officer and CDC and public health standards for articulating and promoting best public health practices. And I think because of my background, my personal values reflect and support this. So it seems rather straightforward to me.
Okay. All right. Thank you.
All right, question number 5 will be asked by Mayor Byers.
Thank you. I was just unmuting. So Dr. Cate, the question is, health equity is a key public health goal. How do you define health equity? And what are the roles of public health generally and the health officer specifically in assuring health equity?
Okay, so thank you. The definition of health equity is promoting the highest level of health for all. And that involves also addressing inequalities in healthcare access. In addressing health inequities, it's important to have partnerships with community organizations and hospitals, community groups that might have different perspectives to bring to creating programs. So I think that's really an important piece. And then once you have gotten all that input, then you design a program that reflects the community needs, and then implement the program, and then you need to assess whether that program is effective. And so there's you need to review and evaluate and look at the how you have to assess it from a statistical standpoint. Did it really meet the needs? And as a medical officer, I would see myself as a consultant to the process, from supporting the development of partnerships with key community groups, agencies, and then in the review of the program, and reviewing the results from basically start to finish. And that would make sure that's an informed process and that we're meeting the equity and inequality needs of the community.
Thank you, Doctor.
All right, question number 6 will be asked by Melissa Sixberry.
Health is predominantly a function of genes, environment, and behaviors. What is the role of public health generally and the health officer specifically in addressing these largely non-medical factors?
This was an interesting one. I was glad to get these in advance. Again, public health promotes the highest level of health for the entire population, protects communities from the spread of infectious diseases and environmental hazards, and ensures access to safe and quality care to benefit the population. I think the public health department and the officer helps to build it. Again, I think it sort of relates to question number 5, helps to build community partnerships to address the public health issues that have been identified. And the medical officer is particularly trained to identify all the medical and non-medical factors that influence health and make sure they're included in creating programs. And then the public health officer is the spokesperson for those programs and make sure they have been evaluated for efficacy. So at least that's the way I interpreted that question. If you have other thoughts or questions on that, happy to address that.
Okay, and question number 7 will be asked by Commissioner McKinney.
Hello, Doctor. The public and medical community expect the health officer to be the community authority for public health issues. What are the issues that you believe demand health officer expertise? How would you maintain competency in those areas? How would you assure credibility as the medical spokesperson for local public health? And I'm happy to read it again since it's a multi-part question, but I understand you've indicated you've got it in front of you, so I'll allow you to review your notes and respond, and thank you.
Yeah, for sure. So I think when I looked at this one, there's I also have a copy of the health officer qualifications, that I was given. I think infectious disease management, the responsibility for tuberculosis control, making diagnoses and administering treatments, and providing medical oversight of programs. And then I think the medical officer has highest credibility for being that expert public voice in the community. For sound medical practices. And so I think those are some of the key pieces for the medical officer. In terms of maintaining knowledge or expanding knowledge, there are CMEs on infectious disease management that are available, attending the American Public Health conferences, and then talking to my colleagues in public health. Chris Spitters is an expert in tuberculosis control. We have chatted recently, and I know I have resources in the public health community.
Thank you, Doctor.
And Dr. Chris Spitters was the health officer before Dr. Everson for the Yakima Health District.
Yeah, that's how I got to know him. Yeah.
Okay. And next question will be asked by Council Member Nyla Duval.
Okay. I just want to make sure everyone has had time to write their notes down. I know sometimes I'm still writing them, so if we need to slow down the pace, just let me know. So number 8 says, tell us about a time when you built rapport quickly with someone under difficult conditions. What were the obstacles? What was the outcome?
Well, I hate to have to use the same example, but again, when I came into this new job and didn't quite understand the situation, the dire situation we were in, and I hadn't done anything like this before, get a larger organization through accreditation. In that situation, I was quite resourceful, and I looked at the accreditation guidelines, which are many pages long, and we just started to break down the task into manageable pieces, started to work away at each criteria. And then, like I said, I was assigned a young woman who was, to assist me, and we had a strong relationship of respect and a spirit of collegiality. We met regularly, we communicated regularly, and we had a common commitment to the mission. And over months, we created a roadmap for meeting the accreditation requirements. And as I said before, and probably that was most difficult situation I've ever had to encounter.
Okay, thank you. Still writing notes.
I'll just give a few moments before I ask my question, which is question number 9. All right. What would your colleagues say is the most important contribution that you have made to public health? Why was this important to the community?
Well, I don't know how many of my colleagues know this, but when I left Planned Parenthood and returned to my work teaching and seeing patients at Community Health of Central Washington, I brought with me many skills in women's health. And I expanded and ran, and currently do run, a GYN clinic where I teach residents about women's health, and I provide the only clinic outpatient LEAPS, which is a surgical procedure for cervical precancer in Yakima. This has allowed me to offer a curative treatment to women who are underinsured and uninsured, many of which are Latino women, and as you probably know, have a much higher rate of cervical cancer. We've saved lives in our clinic, and I'm very proud of that. Also, I have a very strong and deep partnership with Union Gospel Mission, and I facilitate with the breast and cervical health program, getting women into our clinic. And I really feel this has, and we have a very strong and respectful relationship between us. And so this is one of the things that I've been most, saving women's lives has been a huge accomplishment for me.
Thank you. And then question number 10 will be asked by Commissioner Anderson.
Acknowledging that hindsight is 2020, how do you feel your local health district has performed during the ongoing COVID pandemic? Where do you think they performed well? Is there any aspect of the COVID response you would have approached differently?
Overall, from my reading of the newspaper, and I think the public health department did an amazing job during this really unprecedented epidemic, creating programs and reaching out to communities who are at higher risk, particularly in a time when I'm very concerned that national leadership was undermining the legitimacy of the work they were trying to do. I am particularly concerned that there's not always been a cohesive and consistent messaging from the health department and the Board of Health on how to manage this epidemic.
Thank you.
Okay, do you have any questions for us, Dr. Cate?
I don't quite understand what the next steps are and when we might hear from you. And I also I'm a little unclear. I have the job description, which is very extensive, but I'm not exactly sure what the time requirement is and that kind of.
So I can go a little bit over the process. And so our regular Board of Health meeting on June 30th, there'll be discussion on the qualifications of the candidates and the possibility with a vote at that meeting to decide on the next health officer. And then at that point, there'd be staff then would be working with the person to negotiate a contract with that person. And so if a person is voted in on June 30th, then we'd start those negotiations and work with that person. With COVID, the time, the amount of time requirement has increased quite a bit. And it was up to, Dr. Everson was up to about 130, 140 hours a month. Now Dr. Yucca is about 40 hours a month. So usually typical, it's between 30 and 60 hours a month. Kind of depending on what's going on. So it is a part-time position, but it is, it's probably average about 50 hours a month.
Okay, that's very helpful.
Mm-hmm. Any other questions?
I don't think so. It was very nice to meet you all.
Very nice to meet you. Did anyone else on the committee have any questions for Dr. Cate?
No, just that was good to see you again, Dr. Cate.
Nice to see you, Patricia.
Okay. All right. Thanks again for taking time out of your schedule to meet with us, and we'll be in contact with you.
Okay, take care. Thank you.
Thank you.
Thank you, Dr. Cate.
Have a great day.
Thank you.
Bye-bye.
Bye-bye.
Thank you.
Okay, one thing I also wanted to mention is that all three interviews will be posted on our website after the last interview tomorrow at 7 o'clock, so people can watch them again, or anyone that didn't have a chance to watch would be able to watch them. So we will be posting those. So at this time, we do have a special board meeting. Oh, yes, Mayor?
Yes, I would just request, it went pretty quickly. And I suspect that they all might be a little longer, maybe or a little less, I don't know. But it would be really helpful if we had an opportunity, like about 60 seconds, 90 seconds to finish our notes on one question before we move on to the next, because I kept getting lost in the process.
Absolutely.
Yeah.
Thank
Yeah,
you.
that was one of my concerns too, is that I was still writing notes when the next question was being asked, and it was really, really hard to write down what I wanted to capture from the answers that she gave. So I think it'll be helpful if we could maybe if you can send us the recording, That way it's still fresh in my mind so that I could review it again and make sure I have all the notes again. It just went by a little fast for me.
Yeah, we can do that. And then for tomorrow's interviews, what I'll do is I'll just kind of wait until everyone looks like their heads are up, they're looking at the camera, and then before we go on to the next question.
Okay.
Thank you. That would be helpful.
Probably, Ryan, I don't think it's appropriate to send out a recording without first completing the rest of the interviews.
That's fine. You can send it on Thursday.
I
I
think
just
that's
have
great
to the
idea.
recordings.
a
Yeah,
great
just
idea.
sending them all together would be great after Thursday.
Yeah,
Thank
great
you, Brian.
suggestion, Nyla.
Yeah, we can
Yeah.
do that.
Good idea.
Sounds good. Any other concerns?
Nope.
Okay. All right. So we'll see everyone special meeting at 5:30.
5:30.
you.
All right.
All
Thank you
right.
very much. Have a good day.
One
Thanks,
more
everyone.
question, Ryan. But do you want a copy of our notes? Because aren't you gonna need that like for public records or anything
Yeah.
like that?
Yeah, so your scores and your notes, sent to me by noon on Friday. And then
Okay.
I'll make a chart of how everyone scored and it'll all go out to board members and it'll be part of our board packet. So it will be public knowledge.
Okay,
Okay,
thank you.
thank you.
Thank you.
Yep. Bye, everyone.
Bye.